In a shocking turn of events, a childcare director has been thrust into the spotlight for allegedly misusing her position to obtain opioids. This case not only raises concerns about the safety of children in care, but also highlights the potential for abuse of power and trust in professional settings. Let's delve into the details of this controversial case and explore the implications for the childcare industry and beyond. Hayley Challita, the former director of Edukare Childcare and Preschool in Muswellbrook, is accused of using her staff's Medicare numbers to obtain prescriptions for Panadeine Forte, a potent pain medication containing the opioid codeine. This alleged misuse of personal information has left many questioning the integrity of those in positions of authority and the systems in place to protect individuals' privacy. 4 former employees have come forward, claiming that Challita requested their Medicare details under the guise of updating employment records. These requests were made via text message and the staff members complied, unaware of the director's true intentions. The Herald has obtained 8 prescriptions that the former colleagues say were issued in their names without their consent, shortly after Challita asked for their Medicare details. But here's where it gets controversial. Several staff members, including a 5th individual, have provided text messages from Challita in which she allegedly asked them to give her Panadeine Forte from their own or their family's prescriptions. This raises questions about the boundaries of professional conduct and the potential for exploitation of personal relationships in the workplace. Paige Roy, an educator at the center, shared her experience with Challita. She recounted how the director asked for her Medicare number shortly after starting her role. Roy, like many others, did not suspect any wrongdoing, believing the request was for routine administrative purposes. However, text messages between the two allegedly reveal multiple instances where Challita asked for Roy's Medicare card using various excuses, such as updating emergency information and the staff management system. Other staff members reported that Challita justified the need for their Medicare details by citing regulatory requirements. This manipulation of trust and authority is a stark reminder of the potential for abuse in any setting where personal information is shared. Roy described Challita as friendly, good with children, and someone who developed close relationships with the staff, including herself. However, she also noted that Challita seemed to have ongoing pain issues, which required constant medication. This observation adds a layer of complexity to the case, as it raises questions about the director's personal health and the potential impact on her professional conduct. One text message, seen by this masthead, appears to show Challita messaging Roy, asking if she had anything stronger than ibuprofen and Panadol. In the message, Challita allegedly wrote, "I have the worst tooth pain. I'm in agony," declining Roy's offer of an antiseptic gum gel. "Do you know anyone selling like Panadeine Forte? As you know everyone, instead of me going to doctors, I can just buy lol." This exchange highlights the director's desperation for pain relief and her willingness to bypass conventional medical channels. Roy also revealed that Challita asked her in person for endone, a more potent opioid, which was prescribed to her father for a work injury. It was only after another staff member advised her to review her Medicare records that Roy discovered the alleged fraud. The records, seen by this masthead, show prescriptions for Panadeine Forte twice in August last year and once in March this year, which Roy insists she never visited a doctor about or picked up from the pharmacy. Another prescription seen by this masthead listed Challita's phone number under another person's name. This detail adds to the growing evidence of the director's alleged misuse of personal information. Roy and the 3 other staff members who requested anonymity have reported the fraud to the police. The investigation is ongoing, and the full extent of the alleged misconduct is yet to be determined. One staff member, who wished to remain anonymous, said she suspected Challita was using her card after receiving notifications about doctor's appointments she hadn't booked. Upon checking her records, she found 2 prescriptions for Panadeine Forte that she did not recognize. This discovery prompted her to alert other staff members to check their records as well. "I went through a very bad mental state," she said. "I lost sleep. I was wondering what else she was stealing from me. She had our tax file numbers, our bank details. What else had she tried to get in our names? Another worker found a prescription for paracetamol codeine dispensed in a suburb far from where she lived. In her messages, she noticed that Challita had asked for her Medicare details and date of birth 2 days before the prescription was dispensed. She said she needed the details for her files. It didn't click with me. I had no clue, the worker said. Challita was stood down from Edukare in March, and the center has been contacted for comment, but is not accused of any wrongdoing. The case serves as a stark reminder of the importance of transparency, accountability, and the protection of personal information in all professional settings. It also raises questions about the potential for abuse of power and the need for robust systems to prevent such incidents from occurring in the future. As the investigation unfolds, it is crucial that the childcare industry and other sectors take this opportunity to review their policies and procedures to ensure the safety and well-being of all individuals involved. This case is a call to action for all organizations to prioritize the protection of personal information and to foster a culture of trust and integrity. And this is the part most people miss. The impact of such incidents extends far beyond the individuals directly involved. It erodes public trust in institutions and professionals, making it crucial for all stakeholders to work together to prevent and address such issues promptly and effectively. What are your thoughts on this case? Do you believe that stricter regulations and oversight are needed in the childcare industry to prevent similar incidents from occurring? Share your views in the comments below.